The United States has passed another grim milestone, more than 250,000 coronavirus deaths. According to the COVID tracking project in Idaho, 2 in every 5 people tested are infected. CBS 4's Carter Evans has the latest.
With hospitals across Idaho nearing capacity, doctors worry about what will happen when there are no more beds.
We would be in the unimaginably bad situation of needing to make decisions about who gets it and who doesn't.
Dr. James Souza is the chief medical officer for St. Luke's Health System in Boise.
If a heart attack victim comes in and the ICU is full of COVID patients, what do?
We do our best. And if one of those COVID patients has a lower chance of survival, we make decisions about who gets the bed.
How far away are you from something like that?
Our modeling is suggesting that we may be facing that scenario in December.
Despite nearly 800 deaths, Idaho's Republican governor has resisted issuing a mask mandate, a requirement some residents oppose.
All they're trying to do is control you. Everything you do is based on the mask and the disease, and it's wrong.
With the U.S. now averaging about 160,000 new cases a day, nearly 36 states now have a mask mandate, with Kansas being the latest to issue the order on Wednesday.
How we choose to respond can turn the tide for our businesses, our hospitals, and our schools.
But in South Dakota, which is experiencing one of the worst COVID outbreaks in the country, Republican Governor Kristi Noem reiterated her opposition to mandating masks, even though the state's medical association said Tuesday it strongly supports the move.
I don't want to approach a policy or a mandate just looking to make people feel good.
Around the country, frontline workers are concerned and frustrated. In Nebraska, more than 1,700 healthcare workers signed a letter pleading with people to wear masks, stating the life you save may be your own.
There's a sunny day on the other side. I'm way more interested in cooperation than compliance.
So you're saying wear the mask, social distance 6 feet, and you don't have to shut down the economy.
That's exactly what I'm saying.
For doctors to begin deciding who gets a bed and who doesn't, the governor here in Idaho would have to declare a crisis standard of care. In the meantime, with hospitals inundated as they are right now, doctors are concerned they might not be able to provide the level of care needed. Carter Evans, CBS News, Twin Falls, Idaho.